Hi, Dr. Brenner. I understand that you installed ozone faucet in your practice about a year ago. I'd just like to have some feedback from you on exactly what you've been doing with the product and what your experience has been.
Okay, well, first the staff was skeptical that water is going to disinfect surfaces or be as effective as bleach in wiping down surfaces and everything, because there's a little bit of an odor, but there's no side effects. There's no residue, there's no staining or anything. As they started to use this over the past year, they've got more and more confident, and we've been using it for a lot more things. One of the things we do is we wipe down, you can't use chemicals on this leather chair, so we use the ozonated water now, which harms nothing. The hoses, when we would use like these wipes, this side wipes, well, you can see the surface of this, everything gets yellowed. And the hoses got yellow, they get stiff, we have to replace the hoses every year. We used to use a cold sterilized solution for our plastics. I'll show you that in a minute. For our X-ray equipment, and we now soak it in the ozonated water, and there's no taste to it. There's no yellowing of the plastics anymore, so they last longer. It's been great for saving money because I'm not buying the Maxide disinfectant solution to soak the instruments anymore. So everything gets rinsed with ozonated water. We wipe down all the lights, the chairs, everything gets wiped down with the ozonated water now. We even clean the bathroom with ozonated water.
So I understand that you had some lost employee days during the cold and flu season this year. What did you do with the ozonated water in that case?
Well, so everything that she had touched or came in contact with, we wiped down with the ozonated water. When she did come back to work, I had her rinsing with the ozonated water. And we had no patient outbreaks of flu from our practice, and no other employee got the flu. So this chair has newer hoses, and all we've used the last several months is ozonated water, and they look brand new still. So there's no yellowing, there's no changing of discoloration, there's no stiffening of the hoses. Same with these tubes over here. Everything looks like brand new and stays the same color. All our chairs look brand new because there's no discoloration of the white frame or the staining of the black leather. We wipe down the countertops, we wipe down this, the tray, the light, and everything looks brand new. And it's because the ozonated water is doing the job without leaving any residue.
Have you been able to eliminate any chemicals from your practice?
Maxide. We don't use the Maxide, and trying to get them to stop using those wipes anymore too. The Maxide wipes are, and if they do use those, then we're going over that with the ozonated water to just try to stop the yellowing of the equipment.
So what do you have there next to the chair? I see you have a receptacle with ozonated water.
Okay, want to take this off? So you just lift this up, turn it, and the whole unit comes off. Ozonated water's come out.
Yep.
We let it run about a minute. Get it as cold as we can, and this is a 2-liter bottle that we fill up about every hour. And they want the same thing. Okay, so to put this back on, you just slide this up here. It's a little groove that engages here. Turn it. Ready to go.
So we're in our lab now. This is where we keep our X-ray sensor holders. In the past, we would fill this bin up with a 30-day cold sterile solution, where every 30 days you have to change it. And once you used an X-ray holder on someone with their sensor, you'd come in here, rinse it off, and toss it in this bin with the chemicals. What we do now is we keep this bin full with the ozonated water. So it's full right now. Here's our faucet, turns on the water. So this is a used X-ray sensor holder. What we would do is come in here, rinse it off, and then toss it right in. Now after 30 minutes, we come in, and what we'll do is lift this up, we'll drain it out. No need to rinse because it's already sterile, and then we just dump this out. and we refill this up the next time someone comes in with a dirty piece of equipment. So I'm just going to show you here how this works a little bit. Turning the faucet on, this is just regular water. When you want the ozone to come on, you turn this, and you see the blue light, and now you know that you have the ozonated water. And what we do is just go in here, rinse off our stuff, take it apart, and go ahead and toss it in.
What have you noticed about using the product and on your skin itself? Are you noticing any effects whatsoever?
Well, I constantly have very dry skin, and my skin cracks. And this cracked because of last weekend with the snow. And the first thing I did was I couldn't wait to get to the office so I could wash my hands with the ozonated water a couple of times because it starts to heal it immediately. It starts closing up, and it doesn't hurt, and it's been wonderful. If anybody who could use it, they should have it.